Man, I am absolutely exhausted. Hi you guys, and welcome back to my channel. It is Shay Michelle, and I'm so happy that you're joining me today. Today is gonna be a once in a I don't want to say once in a lifetime, but once in a first vlog. So basically for the next 3 days I will be doing overnight shifts in the emergency room. The next 3 days happen to be the weekend, and so a lot of, you know, trauma and emergencies happen. So I'm very intrigued to see what I see and what goes on and everything of that nature. If you don't know, I am technically, I guess, a third-year medical student, and we're now in our clinical rotations, and right now I'm in my emergency medicine elective, and so that is exactly why I have this series of overnight shifts. I do have 2 weeks of emergency medicine, but this is like my weekend portion of overnights, and I've never done overnights in my life. To tell you guys exactly what my schedules looks like today is Saturday, and I am going to be in what we call resus. Basically the hospital here has different portions of the emergency room, and resus is where all the trauma cases go. So when we say trauma, we're thinking of like car crashes and like, I don't know why nothing's else coming to mind, but you know, like trauma and like, yeah. Today I'm in resus from 6 p.m. to 3 a.m. okay, and then tomorrow I'll be in another portion of the emergency department from 7 p.m. to 7 a.m. Then Monday night I will be in another portion of the hospital or the emergency department from 11 p.m. to 7 a.m. Then I basically get 24 hours to get myself together, and then that next 7 a.m. I'll be doing a shift from 7 a.m. to 7 p.m. and then that'll be my final like shifts for this elective of mine. I've already had like 4 shifts already in the emergency department, but just during the daytime. So I'm really intrigued to see if there's kind of like what the difference is at night when it comes to like staffing and like what we may see and just anything of that nature. I'm very, very, very interested. And I'm kind of excited, and I'm more so intrigued to see like how I'm gonna stay awake, just because, you know, y'all know I have a very, you guys know I have a very strict bedtime that revolves around like a 10 to 11 p.m. But now I'm gonna be up until like 3 a.m. or 7 a.m. like nonstop. And I don't really drink coffee like that, so I know I'm definitely gonna indulge in the coffee. Just took a nap because I was trying to prep for tonight and I was already exhausted, so I was like, oh my gosh, I have to take a nap, because if I go to the hospital like this, I'm going to fall asleep at like 8 p.m. and we would never survive. Because I'm in the like emergency department, specifically in this trauma area of the emergency department, I don't necessarily get the full, like we don't necessarily do a full HPI, or a what that stands for is history of present illnesses, when you ask for like all the information regarding the illness, including like onset, precipitating factors, quality, like you want them to rate it 0 to 10. Like these are more so patients that either 1 can't really communicate with you like that, or 2 are in just such immediate need for like medical assistance that, or medical intervention, that they, you know, it's just not an appropriate time to start asking like a multitude of questions. But in some cases there are times where you do get the chance to ask all of this. But yeah, so in recess I don't necessarily do all that. It's 5:22 right now. I'll probably stick around my room until like 5:30, and then I will head on my way for my 6 p.m. to 3 a.m. shift. Let's go. The parking lot is so empty. Look at this. There's like no cars here. So I'm interested to see how many people are here. It is Saturday, so. It is so empty, but I feel like it's probably gonna be so like crowded once I get to the actual ER, but it's been so empty my entire walk. It is 10 p.m. right now. I know you can probably barely see my watch, but it's 10 p.m. so I've been here for 4 hours, and the last 4 hours have been so high-paced. The moment I got here, there was so much happening. We've seen it all. This is the first time I've been able to like sit down and grab a snack, but 4 hours in, we still have until 3 a.m. So we still have another 5 more hours. So halfway done, kind of. But this has been a really, really good shift. Some of the things that I've been learning about and they've been trying to teach me is a little bit more about the FAST exam. And basically it's like an exam that you do with traumas just to make sure there isn't a pulling of like blood in the abdomen. And then you can do like an extended fast. And mind you, like I'm not giving any medical advice. I'm just like telling you guys what I learned. Like pulling of blood in the abdomen, near the bladder, the heart, the lungs. And so you use an ultrasound for this. So that's something we've been like really going over, because they do that with a lot of the trauma cases that come in. Other than that, yeah, I think this is the first time I've been here at nighttime. So in my opinion, I feel like there's like more things happening, but simultaneously a lot of people are like, it has not been this busy for a while. So there's just like a ton of stuff happening. I guess like for learning purposes, this has been a really good day, because I have seen so many things ranging from like pulmonary embolisms to gunshot wounds to like this new thing, ECMO. Basically when you're trying to bypass the heart and the lungs, if you need to do something like a really intense surgery, just different lacerations and falls and everything. My midway update, I'm gonna come back at like midnight, hopefully, if it's not too like busy, and then give you guys some more updates. But I think we'll probably do a lot more talking, because it seems that everything has like slowed down a ton, and so now it's like easier to talk to the residents and ask more questions and stuff like that. But I'll definitely kind of like break down what happens. I'm gonna check in because it's officially 12:15, so we've reached the midnight mark, and it has not slowed down at all, or it picked back up. But yeah, they've been letting me do little things, which is really cool. I actually did my own fast, and obviously it's completely guided with the residents, so it's not like I'm doing it literally by myself. They're completely directing me, but it was cool because I really am not good at, or I don't consider myself good at ultrasounds. Ultrasounds are just really hard to see everything, and I did it. I was proud of myself. And so yeah, they're letting me get a lot more involved. There's less like doctors around and stuff, just because it's nighttime, but it's also Saturday, so there just tends to be, I feel like, more like trauma and accidents that happen. So yeah, I'll make sure, I'm gonna tell you guys all about it when I get home, but this was an update. I literally just walked back into my room. It is 3:18 a.m. in the morning. Now I'm just gonna go to sleep, and then I have to be back at the hospital at 7 p.m. and then I have a 12-hour shift from 7 p.m. to 7 a.m. but I'll be in a different ward of the actual emergency room, so I won't be seeing like the same types of kind of like same types of like interventions. Today, remember, I was in the trauma area. I think today was a really good learning day because there was a fourth-year medical student that was also with me, and so he was able to like tell me little tips, like, you know, people like when the med students, if a trauma case comes on, obviously the first thing that all of the physicians are worried about are like airways, breathing, their heart, all that. And so sometimes what like is beneficial for the med student to do is kind of like, you know, yes, we don't want to get in the way, but we still want to be helpful. So like taking someone's socks off and taking their shoes off, because a lot of time we look for those dorsal like pedal pulses. Don't quote me right now, it's 3 in the morning. But all those like foot pulses, posterior tibialis pulse, and things like that. And then even like helping kind of like cut people's clothes off, because if you're in trauma, the first thing that you're getting done in the actual emergency room is your clothes are getting cut off, because we have to be able to like really hear and see everything and just document every single thing. If you have any cuts, scrapes, like literally everything has to be documented. They were super nice because they taught me how to do the FAST exam. And while we're here, I might as well just, now that I'll just Google what a FAST exam stands for. FAST stands for Focused Assessment with Sonography for Trauma. And basically that's just like making sure that you don't have any like pulling of blood in any specific places. And so when I was practicing, they let me practice on obviously a more stable patient, while also 100% guiding me every step of the way. But it was cool. Today, I feel like I just saw a ton of different cases, just ranging from more psychiatric focused cases all the way to more kind of like neuro cases where there's like brain trauma and skull fractures to like displaced hips and stuff like that. So one thing I really do like about the ER is the fact that You can go to the ER. You don't know, you know, what exactly is going to come into the hospital, but one thing you do know is that it's going to be a wide range. There's not just going to be one day and you're going to see the same exact thing. So that is one thing I really like about the ER, the unpredictability. I am going to go to sleep and I'll see you guys in the morning. I guess I won't see you guys anymore. I see you guys in the afternoon. Good morning, you guys, and happy Sunday. It's morning for me, but not morning for most. But basically, it's 11:20 right now. I always do this as if it's ever gonna focus, but it's 11:20 right now. I woke up at 10 a.m. So I was asleep from like, what, 3:30 to 10 a.m. And then I laid in bed, of course, until 11 a.m. And then basically I just took a shower and now I am up and ready to go. So like I said, I have to be back at the hospital by 7 p.m. today. So that gives me like, what, 7 hours? No, 6 hours. I don't know, something like that. That gives me like 6 hours to kind of get myself together and do what I want. So for today, I've been planning on cleaning my closet for about a month now. So I think honestly, I'm just about to like clean my closet. Hopefully, I don't plan on spending more than an hour on that. And then I'm hoping that I'm hungry by then, because I feel like since this schedule is all off, like I don't even know when to eat. So I'm hoping by the time I'm done cleaning my room, I'm hungry, and then I'll eat something, and then I'll probably take an hour rest, because I'm predicting. I know me, and I know after this, I'm gonna be like, woo, you did so much work today. And then I'll try to get started on my flashcards and some first aid reading. Time to clean. I just finished cleaning my closet and it's taken much longer than I expected. But it took me 2 hours and it's now 1:30. I'm proud of myself. This is all the stuff I'm giving away. Like I said, it's 1:30. I haven't eaten breakfast and I'm a little bit hungry. And I always try to make sure I eat before I go for these long shifts, because I don't know, I mean, the cafeteria is closed at midnight and there's not really anything there for you to eat. So it's kind of like now or never. So I try to load up on food. I'm just gonna make myself some breakfast and then probably finish cleaning my room, because even though I clean my closet, the rest of my room is a mess. And then we'll finally get, I hope to get like at least 2, maybe 3 hours of work done, but I'm not gonna, you know, I'm not gonna overextend myself just because I do have a 12-hour shift coming. Update, we're scratching breakfast because a few days ago I made some of that viral like lasagna soup. I mean, mine isn't really soupy, but it's more like just deconstructed lasagna, but it's still good. It's 5 p.m. and I just woke up from my nap. And at this point in time, I simply cannot fathom making myself dinner, because so I'm just gonna walk over to Chipotle and get me something to eat, and then I'll probably just get dressed, and then next thing you guys know, I'll be at the hospital for my 7 p.m. report time. I am dressed and ready in my scrubs. We're wearing navy today. It's only like 6:10, so I'm about to prep some snacks for myself and then I'll be on my way. So I wanted to say that even though no studying happened today, I'm very optimistic for tomorrow, because I don't have to go to the hospital until 11 p.m. So I will have plenty of time to like sleep and just get myself together. And then basically cleaning my closet was kind of the last thing on my like random to-do list of things I've been trying to accomplish. So now that's done, I actually have nothing else to do. Okay, time to go. It doesn't zoom in, but we're here. It is 6:35, y'all, or whatever time it is. I don't know what time it is. And they told me I can finally go home, so I'm leaving. Did a full shift, and honestly, I'm just about to go to sleep, and we'll talk about this later. Good morning, you guys. It is 2 p.m. on Monday, and you guys know I've been sleeping all day because I didn't leave the hospital until 7 a.m. this morning, basically. And I feel like right now my body's in a limbo of trying to figure out if I should be hungry or what should be happening at this time of day. I'm like, I don't even know what to think, but I'm just happy I feel well rested because I have to do another round of overnight tonight. So tonight I'll be in the hospital from 11 to 7 a.m. So I started a little bit later. It was like an interesting schedule. It kind of just like slowly got later and later and later. Right now it's 3:30. At 5 p.m. I actually have like an admitted students panel to do. And basically I honestly have no background at all on what I'm doing, but it's for all of the students that are thinking about possibly coming here, and it'll just be via Zoom, and I'm just there to like be a third year and like answer questions, I guess, as they come. For the next hour or two, I'm just like eyeing my first aid book. I think what I'm gonna do honestly is I'm just gonna reread the psychiatry or like psych section in my first aid book, and then I'm gonna follow up and do some flashcards with the remaining time that I have, and then from there we'll just figure out what I'm gonna do. But the rest of the day will probably mostly flashcards. Oh, yesterday, let's talk about my shift yesterday. I barely had any time to go to the bathroom and just like make a random like video, because I was like actually working most of the time. I was pretty wide awake the whole shift, except for 6 a.m. I just reached like a stopping point of like my body saying, you're supposed to be asleep right now. Yesterday, I was basically in one of the sectors of the emergency room that's kind of, I guess, triage to be the least severe cases, but still people who need a room. Or there's also like a chair section where you'll go and see people, but like people who are stable. I really like this section of the emergency department because it's very procedural, and so you'll see people like repairing, you know, finger lacerations, or if people have like little cuts or bruises or little abscesses, sometimes you'll see them kind of like draining those abscesses, which can be therapeutic and diagnostic, because you can send the fluid to the lab to figure out exactly like what bacteria or whatever, what else is in kind of like that fluid. I was like actually doing things, because these patients are a lot more stable compared to the people I saw my first night. I was given the opportunity to like go see the patients before the actual physician did, and then talk to them, and then I would come back, report to the physician on everything the patient told me, and then we would go in together. I would do a full history. I would get like an entire HPI. I would ask questions about surgical history, past medical history, medications, allergies, family history, if anything runs in their family, if they're on, I said medications, but a big one is like if they're on any type of blood thinners, and then like just do a review of symptoms, asking about like nausea, vomiting, headache, fever, chills. After that, I do a physical that pertained to what they did or what was going on for them. So like someone had abdominal pain, so then I would do an abdominal physical exam, which for the most part involves a lot of listening and then a lot of pressing down to figure out where exactly in their stomach do they have this pain, or in their abdomen, because depending on where they have this pain will also depend on what are the most plausible kind of like illnesses happening. Didn't have much sitting time, and then when I did have when I did have more sitting time, I didn't necessarily want to like run away to the bathroom just because everybody would be around, but I would just like get on my iPad, and so I would do flashcards. I was also making like a cool, like what I called rotation master guide on like different questions you should ask your physicians or like your intern or whatever. So like day 1 or day 2, like making sure you set the tone on like, so this is the quote I put, but obviously you do an iteration, but I'm like, I want to make sure that I do my best this rotation. What are the general expectations for medical students, and how can I go like above and beyond? Weekly, just asking for feedback, and then as needed, just making sure you ask like, oh, how can I help when this happens? So like, for example, someone, you know, when I was in recess, being like, how can I help when a code happened? And a lot of times they're like med students, you know, taking the shoes off, taking the socks off, you know, helping cut clothes off and stuff like that. One thing like patients absolutely love knowing that you care and that you're telling them the information as you also know it. Like one patient, we were like waiting on a CT scan, and as soon as we got it, I went and updated her, and she literally said like, thank you so much for not forgetting about me in this like random corner room. And I said, oh my gosh, she's like, we would never forget, like I'm here, like let me know if you need anything. And this happened last night in the emergency room. It's like little things like that that physicians take note of and patients take note of, because at the end of the day, you're here to serve patients. Now 3:47, because I've been talking for the last like 15 minutes. I'm gonna finish that Chipotle I got yesterday. Hopefully it doesn't look too crazy. And then in the next hour, like I said, I'm just gonna read my first aid, do some flashcards, and then I'll be back during my little panel. Yeah, I can't really speak much to this because we haven't gotten grades back for our first rotation. Like I just finished internal medicine. I just finished my admitted students like talk panel. but it was pretty small. So basically just some students asked us very specific like questions. So now what I'm gonna do is I'm gonna take a 10-minute break because you guys know I feel like I'm just exerting myself by opening my eyes. Before the panel, I was able to reread the psych section in my first aid book, so that's done. So now what I'm gonna do is I'm just gonna watch all of the neuro/psych sketchy videos. It's like 5:50 right now, and then after this I'll probably just rotate between these 3 tasks, and then from there it'll be time to go to the hospital. The time has come. It is 10:04 p.m. so I'm officially a night owl by, you know, per my schedule. No, I have to be at the hospital at 11 p.m. I get out at 7 a.m. tomorrow. Basically, anytime we work with blood or possibly an artery where there's like high pressure and don't know how it's gonna be, like they have these little disposable goggles that you can wear and stuff. So I was like rushing out of there because I was so tired yesterday. I forgot to return these goggles. So I'm gonna just wear them there just because why not. Side note, so a lot of physicians, they don't really wear their stethoscopes around their neck anymore just because you're coming in contact with a lot of different people with the stethoscope. So a lot of people use this little belt clip, and so you just put on your waistband and basically it'll just hold your actual stethoscope. Exhibit A, you insert, and then it's just an easy Velcro. So it holds like this, and then you just put it right here on your waistband. That is all. I don't really have to do much packing because I didn't really eat many of my snacks yesterday, so those are all there. I have all my chargers, I have my iPad. Let me throw in my gloves. What I carry directly on me is I always carry myself a little notepad and pen light, because a neuro exam is always done to make sure people's like pupils are equal, symmetrical, all of that. As soon as I get back, I will immediately be putting this eye mask on and going to bed. In the next like 20 minutes, I'll drive over and we'll go from there. I'm telling you guys, there's gloves everywhere, so I always come home with like extra random gloves in my pockets and everything like that. I'm excited. It's my last day of nights, and I'm not gonna lie, kudos to everyone that does this routinely, because man, I am absolutely exhausted. Like, well, let's go.
It's 6:33 a.m. and I'm just now getting back to my car after my shift. They always let me leave the hospital a little bit earlier than like originally designated, I guess, because the last hour of every shift is like dead hour and they don't usually see any new patients, meaning like there's nothing for me to do because all the physicians are doing is just finishing all of their notes and everything and getting ready to do a shift change. So that's why I always sleep early. But woo, I feel like I always jinx it when I say, oh, I'm gonna make sure to vlog, and then I don't vlog, because today was the day I was up and about the most. They had me like every single procedure. Either I was like doing something to help with it, or I was there to watch it. And this was the very first time I ever wrote a note in like my hospital system, because you guys know previously I was at like a different hospital, so that was cool. I had to write notes for the very first time, and honestly that took hours because I didn't know what template to use. And then like also I'm in the emergency room, and the emergency doctors write different notes than like other doctors, and everybody does something different, so I just didn't know what was happening. I feel like this was like the most kind of, in a way, independence I've been given this whole like 2 weeks. And so yeah, I just didn't have any time to like walk away at all. But yeah, it was pretty cool. I did another fast exam with the ultrasound with one of the residents. I helped them put like a cast on someone. I didn't like do it or anything, I just helped like with it. In addition, they did kind of like another diagnostic / like therapeutic kind of like aspiration of someone's like knee, and so I was like there for that. That's what I've been up to for the last like, I don't know, 10-12 hours. I don't know how long it is. You know, you get kind of delirious starting 5 a.m. No, I'm joking. On that note, you guys, I'm going home, I'm going to sleep, and I just want to say thank you guys for watching this vlog. It was definitely one in a kind. I don't know the next time I'll ever have just multiple nights in a row like this, or at least it won't be for a little bit. I definitely do know that. But I hope you guys enjoyed it, and don't forget to like, comment, and subscribe, and I'll see you guys in my next video.
I'm very excited. I got my hair done, so at least I can look nice on the clock. And yeah, so